Definition of diabetes. Diabetes in general is a disease that affects how our bodies metabolize carbohydrates. Our body uses the insulin that it makes to process the carbohydrates into sugars and put that into our cells. When we don't have enough insulin, then that sugar hangs out in our bloodstream, and that gives us the high blood sugars that a lot of diabetics will have, or also called hyperglycemia. So type 1 diabetes is typically seen in kids and young adults, and it is more related to an autoimmune disorder, and it's actually where those people don't produce insulin or don't produce very much insulin, and typically require insulin medication to take daily. Type 2 diabetes is something we see more in older adults, although we're seeing it more in kids now since we're having issues with childhood obesity. And it's a disease that is definitely more related to lifestyle and diet factors. And those with type 2 diabetes may still produce insulin, but again, maybe not enough. But what makes them different is that they are also resistant to the insulin that they produce. So their cells just do not respond to it like we would hope. Prediabetes is a term we use to identify those at high risk for developing diabetes. We test people with a blood test to see, if you have prediabetes or diabetes. Those tests are hemoglobin A1C, which gives you an average blood sugar over 3 months, and anything that is 5.7% to 6.4 would be considered prediabetes, with anything over 6.4 being considered diabetic. We also check fasting blood sugars, and anyone that has blood sugars from 100 to 125 we consider pre-diabetic, with anyone 126 or higher to be diabetic. So typically people that have diabetes will have weight loss, vision changes, increased thirst and urination. You'll even see sometimes that they'll be getting up in the middle of the night just to drink, to get drinks. So I also help Dr. Miller Parrish with the wound clinic here at Scotland County Hospital. And we see quite a few diabetics in our wound clinic. Diabetics are at high risk for developing non-healing wounds, especially like on their lower extremities or their feet. And this is because diabetes, and especially uncontrolled diabetes, affects the large and small blood vessels and also your nerves, and can cause a complication called neuropathy. And people that have this do not have good feeling in their feet, so they may not always notice when they have an injury. And so that's why it's really important that we talk to our patients, and at least yearly that we examine their feet, but encourage them to examine them more often. We also strongly encourage diabetics to wear diabetic shoes, because normal shoes can cause calluses and pressure areas that then break down into open wounds. And again, a diabetic is a complication is just, again, it's difficult to heal their wounds because of, again, the effect on the blood flow. They also have some immune deficiency, which then just puts them at more risk for infections, and then leading to, us needing to use antibiotics, and again, for the wound taking even longer to heal. So the best advice would be to maintain a healthy weight. Like I said, watch your diet, try to, limit your carbs and simple sugars. Get some exercise, for 30 minutes most days of the week, and at least have yearly checkups with your primary care provider, so that they can assess your risk for diabetes and make sure that you get the proper testing if needed.